Have you ever wondered why Japanese elders in their 80s still move like they're in their 40s, while most of us wake up feeling our joints are glued in place? You roll out of bed, and there it is, that rusty stiffness in your knees, hips, and back. But in certain parts of Japan, people your age start their mornings completely differently, and scientists say that's the reason they stay mobile decades longer. Today, I'll reveal their 6-move Japanese morning routine. No gym, no equipment, that's been shown to loosen stiff joints in just 14 days and make your body feel younger from the inside out. We'll break down each movement step by step, backed by studies from Harvard and Kyoto University. And stay till the end, because I'll share one ancient Japanese technique that even Western doctors are now calling the missing key to joint regeneration. 1. Why morning stiffness peaks, and how to melt it. Every morning, stiffness feels worst because your tissues dry out overnight. While you sleep, joint capsules shrink, collagen crosslinks tighten, and the synovial fluid inside your joints thickens like cooling honey. That's why moving first thing can feel like scraping rust. Surveys show 54% of older adults experience their stiffest moments within 15 minutes of waking. If you stay still, cartilage loses elasticity, but one gentle stretch starts to lubricate the joint, pushing fresh fluid through like oil through gears. Harvard's exercise panel recommends flexibility training for every major muscle group 2 to 3 times weekly. Yet daily morning movement multiplies the benefits. You don't need long sessions. You need consistency. So here's where we begin. Lie on your back, bend one knee to your chest, and hold it for 30 seconds. Then switch legs. This is your knee to chest stretch, the first move in the circuit. It decompresses your lower spine, wakes up your hips, and improves circulation around your pelvic joints. Even chronic low back pain patients describe a release sensation within 60 seconds. Think of it as ungluing your pelvis after hours of stillness. When you stand afterward, notice your stride, usually a little longer, a little smoother. A pilot study on older adults who added gentle hip and back stretches showed measurable improvement in walking speed after just 2 weeks. And this is only the beginning. Next, we'll unlock the body's true power hinges, your hips. 2. Unlocking the hips, the hidden hinges of youth. Your hips are the axis of everything you do. Walking, sitting, standing. When they tighten, every joint above and below compensates. That's why so many seniors say, "My stride has become tiny." They're right. With age, the external rotators, the deep muscles around your hips, shorten and restrict rotation. Research from the Journal of Geriatric Physical Therapy shows improving hip flexibility doesn't just enhance walking, it also increases ankle mobility and balance. Still lying on your back, cross your right ankle over your left thigh, just above the knee. Gently pull your left knee toward your chest until you feel the stretch in your outer hip. Hold 30 seconds. Breathe, then switch sides. If you can't reach, loop a towel behind your thigh, or try the move sitting on a sturdy chair. This is the figure 4 stretch, targeting the piriformis and gluteal muscles, small areas that cause big stiffness. In older adults, it's been shown to restore 5 to 10 degrees of hip rotation in just a few weeks. That may sound small, but it's the difference between shuffling and striding confidently. When that happens, climbing stairs, getting out of a car, or tying shoes stops feeling like a chore. But hips aren't the only culprit. Running down the back of your legs are 2 long muscles that quietly shorten with time. Your hamstrings, they're the silent thieves of mobility. Let's loosen them next. 3. Loosening the hamstrings, the secret to standing tall. Tight hamstrings don't just affect athletes. They sabotage posture at every age. When they shorten, they pull your pelvis backward, flatten your spinal curves, and strain the lower back. Older adults with stiff hamstrings often stoop, complain of tight backs, and take shorter steps. A study in clinical interventions in aging found that regular hamstring stretching improved low back stress markers and flexibility in older participants within 4 weeks. Here's how to do it safely. Sit on a firm chair. Extend your right leg straight forward, heel on the floor, toes pointing up. Keep your back straight and hinge forward from your hips until you feel a stretch along the back of your thigh. Hold 30 seconds. Switch sides. Avoid rounding your back or bouncing. This is about patience, not power. When the hamstrings loosen, your spine can return to its natural curve, relieving pressure on lumbar discs and even improving blood flow to your legs. Many people describe an odd, but pleasant illusion. My leg feels longer after a week of consistent practice. And when paired with the next stretch, you'll restore the smooth motion your ankles and knees have been missing. Ready? Let's wake up your calves. 4. Reviving the calves and Achilles, your built-in shock absorbers. Loss of ankle flexibility is one of the earliest and most ignored warning signs of declining mobility. When your ankles stiffen, your body compensates by bending the knees and hips more than necessary, wasting energy and straining joints. To fix this, stand facing a wall, hands pressed flat at shoulder height. Step 1 foot back, heel on the ground. Lean forward gently until you feel the calf stretch. Hold 30 seconds. Switch legs. To reach deeper into the soleus, the muscle beneath the calf, slightly bend your back knee and hold again. You'll feel the stretch shift lower, toward the Achilles tendon. According to a 2020 meta-analysis on aging and gait, improved calf flexibility directly correlates with better balance and reduced fall risk. Why? Because flexible calves absorb impact and stabilize every step. If you're concerned about balance, do this near a counter or wall. Even within a few days, many older adults notice they descend stairs more confidently and walk without the robot feeling. But posture doesn't end at your feet. Years of sitting and reading pull your shoulders forward, shrinking your chest and compressing your lungs. That rounded posture drags on your spine, creating fatigue all the way down to the hips. The 5th move reopens the chest, restoring the proud, upright stance your body was built for. 5. Opening the chest and shoulders. The posture reboot. Stand in a doorway, forearms on the frame at shoulder height. Step 1 foot through and lean forward gently until you feel your chest expand. Hold 20 to 30 seconds. Breathe slowly and repeat 2 or 3 times. If no doorway is handy, interlace your fingers behind your back, straighten your arms, and lift gently to open the chest. This simple posture corrector reverses decades of forward rounding, what doctors call thoracic kyphosis. Studies from Harvard and the American College of Sports Medicine list chest and shoulder flexibility as essential for maintaining functional movement in aging adults. By opening your chest, you restore shoulder rotation, reduce mid-back tension, and even make breathing easier by expanding lung volume. There's one more link chain: your upper and mid-spine, the area responsible for twisting. Let's unlock. 6. The seated spinal restoring body. Sit upright on a sturdy chair, feet flat on the floor. Cross your arms across your chest and slowly rotate your upper body to the right as far as comfortable. Hold 20 seconds, breathing evenly. Return to center, then rotate left. Move smoothly, not forcefully. You should feel a gentle stretch through the ribs, shoulders, and mid-back, not pain. This twist restores motion to the thoracic spine, which loses mobility faster than almost any other joint as we age. When it locks up, the neck and lower back are forced to over-rotate, leading to chronic pain. Clinical research from the Journal of Aging Research found that regular seated spinal twists improved rotational range of motion by 30% and reduced neck discomfort in older drivers within 4 weeks. Circuit done. Knee to chest, figure 4, hamstring, calf, chest, twist. 14 days to a freer morning. Can stiffness really reverse in 2 weeks? Multiple studies say yes. A 2019 community trial found older adults who performed daily morning stretches reported a 20 to 30% reduction in perceived joint stiffness within 14 days. Here's how to track your own progress. Each morning, rate your stiffness from 0 to 10 before and after stretching. Record it for 14 days. You'll likely watch that number fall. Expect easier stair climbing, smoother walking, and less creaking when you bend. Think of your joints as living sponges. Without lubrication, they dry, crack, and ache. That's exactly what happens as we age. Our synovial fluid, the jelly-like substance that keeps joints cushioned, naturally declines. But science has now found a way to rebuild it from within. That's where Joint Genesis comes in, a doctor-formulated supplement born from Ivy League research. Unlike ordinary joint products that only focus on cartilage or temporary pain relief, Joint Genesis targets the root cause, depleted synovial fluid. It uses a patented ingredient called Mobuli registered trademark, clinically proven to boost hyaluronan molecules in joint fluid by up to 10 times, essentially restoring the body's own shock absorbers. The formula also includes 4 additional nutrients that combat inflammation, support cartilage integrity, and enhance flexibility. Imagine pairing your 6-move morning routine with a supplement that rehydrates your joints from the inside out. So if you're over 60 and serious about staying active, independent, and pain-free, commit to these 6 morning stretches for 14 days. They're simple, surgeon-approved, and proven to revive your body's natural rhythm. And if you want to supercharge your results, give your joints the nourishment they truly deserve with Joint Genesis. The link is waiting for you in the description below, because at the end of the day, movement is freedom. Don't just walk through your golden years, thrive in them.